Okay, so we're recording. Did you hear that little recording? Okay, so hi everyone. I'm Sadie Metcalf. I use she, her pronouns, and I'm here today with Sarah Egan to talk about birth control for the Let's Talk Sex project. So Sarah, would you like to introduce yourself?
Hi, I'm Sarah Egan. My pronouns are she, her, and I am the Director of Clinical Services at Planned Parenthood Pasadena and the San Gabriel Valley. I'm a certified nurse midwife, and I've been there about 9 years.
Awesome, thank you. So today we're going to kind of talk a little bit about birth control, what birth control is, different kinds of birth control, and I'll just be asking Sarah the questions and she'll be answering. So we're going to get right into it. The first question I have is, what is birth control?
Birth control is anything that keeps a pregnancy from happening or a baby from being born. That could mean a hormonal method like a birth control pill or an injection. It could mean a barrier method like using a condom or a diaphragm. It could mean a user method like withdrawal or like pulling out. It could mean not having sex at all or not having sex with people with sperm, which is the best way to not get pregnant. Or it could mean abortion. All of this counts under the umbrella of birth control.
Thank you. Okay, so how many different kinds of birth control are there? Are there different? So you talked a little bit about hormonal birth control or barrier birth control. How many different kinds are there?
How many kinds? Oh gosh. Well, there are different kinds in different countries too. But generally, there are hormone methods for women or for people with uteruses and ovaries. There are barrier methods for both people with uteruses and people with penises. There are intrauterine methods. I'm trying to think of the different categories. And then there are let me start over. Okay. The way we tend to think of them is short-term, long-term, and hormonal, non-hormonal. So, like for instance, there are two different kinds of IUDs. There's a hormonal IUD, there's a non-hormonal IUD. They work in different ways, though they both have the same outcome. So there are lots of different ways to skin a cat, as they say, and there are lots and lots of different ways to not get pregnant. Some of which are, you need a prescription for, some of which you need a procedure for, and some of which people can take care of on their own. Okay. Sort of a long answer, but I'm not sure I answered your question.
That's okay. You answered it perfectly. So is there birth control for people with penises? Because I've only heard of birth control for people with uteruses.
Well, there's condoms. Condoms only fit on a penis, really. So yeah, that's a good one. Time honored, work great if you're using them. That's kind of it, unless you want to count pulling out or withdrawal, which is also time honored, though not as effective. And other than that, there's a lot of research going on actually, looking into hormonal methods for people who make sperm and trying to either affect what the sperm look like or how quickly they move or the amounts of the sperm in each ejaculate. But nothing is happening anytime soon. So far, for people with penises, we have got condoms or pulling out or not having sex.
Awesome. Cool. So you talked a little bit about pulling out. Does pulling out actually work? Like, how effective is it? Is it a good method of birth control?
It's better than nothing. I mean, if 100 people, you have 100 people who are using the pull-out withdrawal method, 80% of them will not get pregnant that year, but 20 of them will. I mean, it's a perfectly fine way to not get pregnant, but it's really only, I really only sort of It really is only a good option for people for whom a pregnancy would not be a giant disaster. If for either because of your life situation, because of a medical situation, because of a social situation going on in your community, if it would be a disaster for you to get pregnant, it's it's probably better to also use another method.
Got it. So what is the difference between a dental dam and a vaginal condom or an internal condom?
Have you ever seen them before, those dental dams?
Mm-hmm.
Or have you just heard about them? They're like the squares. Hi, Twyla.
This is my mom. She's bringing me the charges for the
Hi, Anna.
So wait, just pause for a sec so she can plug in.
Okay. Okay, so sorry, we're resuming.
All right.
Difference between a dental dam and a vaginal condom.
So the dental dams are just a flat square of latex. A vaginal condom is like a little baggie with like a ring on the inside of it's like a long baggie. It's like a long Ziploc bag, except thinner. And it's got a ring on the inside and a ring on the outside. And the vaginal condom is for when someone with a vagina is having sex with someone with a penis, and they want that barrier protection. You put the inside of the bag up into the back of the vagina. This ring goes around the cervix and kind of holds it in place. And then the other ring sits on the outside around the vulva. It's not that big. It's like this big. And that's a perfectly fine method. It is kind of noisy, which is sometimes a downside for some people. People with penises, if they have to use some kind of condom, tend to prefer that one sometimes, but it is a little bulky and it's kind of hard to use. They're expensive and you kind of sometimes have to hold them in place, which doesn't always work for people. The dental dams are just that square of latex. They're just sort of made to like sort of hold over the vulva. Some people make like underpants to like stitch them into a pair of underpants. They just like pull on their underpants and they don't have to hold on to the square of latex. It's fine. They have a very strong latex smell and taste. And it's not good for people who have any kind of latex sensitivity, but then no condom is, unless they're the non-latex ones. Those internal condoms are usually polyurethane. I think they're not made of latex usually.
Awesome. And then what kinds of sex, like can I use a dental dam if I'm having vaginal or penetrative sex?
It's not going to hold. It's not going to stay. No. No, it's not going to work.
Okay.
It's like, what's the metaphor? I don't know. Like you wouldn't be able to hold it on.
Yeah. Okay. So I'm having really weird side effects from my hormonal birth control, and I've been taking it for about a month. So what do I do when I'm having these weird side effects? And I've looked it up online, and it says nausea, but I'm having really extreme kind of side effects. What do I do in that kind of situation?
Ideally, whoever prescribed the birth control should have warned you a little bit about what to expect the first couple of months. Most people don't have extreme nausea, and a lot of times we tell people to take it with a little bit of food or take it at night before they go to bed, which can help a lot. And sometimes it's just not the right dose for people. And the thing with birth control is that if people don't like it, they're not married to it. I mean, it's not like you have to stick with it or you even have to give it the 3 months that people say give it 3 months. But like we have patients come back all the time after a couple of weeks, not all the time, but occasionally they come back after a couple of weeks and they say, I just don't like how I feel. Either they're too emotional or they feel like their skin has changed a little bit and they don't like it, or they're having nausea and they've tried all the things and it hasn't really worked. And then we find them a different pill or a different method altogether.
So that 3 months. So typically, I've read a little bit about that. And after 3 months, the side effects are supposed to subside. But what about at 6 months and my birth control still kind of not like cooperating with me? I don't like how it feels. Like, what do I do in that sense as well?
Find something else. Yeah, you're not stuck with that birth control. That's not the only thing out there. It's never the only thing out there. I mean, every once in a while I have a patient who's like in her late 30s and she's like, I don't love my birth control, but I have tried everything out there and this is the only thing that works for me. And so she knows what she needs. But for people who like different people feel differently on different kinds of birth control and at different points in someone's life, like before or after a pregnancy, or if they're breastfeeding, or like at different points in their emotional life too, they're gonna have sort of different reactions. So, and usually, I mean, people are the experts in their own bodies. So if they don't like it, they shouldn't they shouldn't stay on it, and they should find something else. That doesn't mean no birth control is good for them. It just means that one isn't. Sometimes you have to date a lot of different kinds of birth control before you find a keeper for a while.
Mm-hmm. And so obviously you talked a little bit about short-term and long-term, and I know those are both like fine to kind of stop when you want to, but what about like the copper IUD that lasts for, 10 to 12 years? Can you still, after a month, just take it out if you don't like it?
You can. But most of the time, because that one doesn't have hormones in it, people don't tend to have hormonal side effects that kind of annoy them. With that one, people tend to have more, they have crampier periods and heavier periods the first few months. And so if someone's getting that IUD placed, they need to know about that ahead of time and be ready for it and have their ibuprofen at home. And they shouldn't be someone who already has really bad periods, because then that's not a good choice for them. Like, they need a lot of preparation ahead of time. And then most of the time they're fine with it. They just get through the first few months, and then whenever they're ready to take it out in a year or in 11 years or whenever, it's easy to take out.
So what about, so I've heard, again, some of my friends are, taking birth control for specifically for acne or for cramps during your period. Are there any birth control? Well, can you talk a little bit about that kind of birth control? That's you're not using it specifically to prevent pregnancy, but instead to have other effects on your body. Like, what is that about?
Yeah, like you're looking for those side effects.
Mm-hmm.
Yeah, that's a really common reason that people are on hormonal birth control, because the estrogen that's in combined birth control pills, especially pills or the birth control patches or the rings, the little vaginal rings, the estrogen in those tend to help almost everyone's hormonal acne. The progesterone that's in the depot injection and the implant, the little arm implant, or the hormonal IUDs tend to make people's periods much, much, much lighter, and sometimes they go away altogether. So that's a really nice treatment option for people with terrible periods, or especially people who have like dangerous periods, like they're getting anemic and they're getting their heavy periods are creating a real problem for them. And some people find that they get like a really bad menstrual migraines or other menstrual, like emotional side effects, and being on a continuous birth control, like a continuous pill or using the ring or the patches continuously, can help those a lot.
Got it. So again, I've heard, so the ring I know can last for 3 weeks, and then you're supposed to take it out for the 4th week. Can I leave it in for the 4th week if I just don't want my period that month?
Sure, go for it. Fine. Don't leave it in for more than 4 weeks, though. At the end of 4 weeks, it needs to come out and a fresh one needs to go in.
Got it.
The same thing is true with the birth control pills. The ones that are monophasic are the best ones to use if you're we call it continuous cycling. And same with the patches. The patches are, you change them once a week for 3 weeks, and then on the 4th week, you don't wear a patch at all. But if you want to just skip that 4th week and put a fresh patch on, lots of people decide when they want to have a period. And some people can go months and months and months, a couple of years without a period. Some people start to spot a little bit at a certain point, and then they're like, okay, my body wants to have a period. So they like stop their pills for 4 days, give themselves a little withdrawal bleed, and then start a new pack.
Got it. So how does hormonal birth control work? Like, obviously, I mean, you're talking about it's just skipping your period, but how does that happen? Like,
so for instance, we'll just use the combined hormonal birth control, like the pills or the patches or the rings. What they do is they tell your ovaries not to develop an egg. So the way I sometimes put it to patients is I say, they like, put your ovaries to sleep for a little while. And your ovaries just don't get that signal to develop an egg, so that therefore you don't ovulate, and therefore you can't have an egg that's hanging around waiting for a sperm to show up and cause a pregnancy. Mostly the combination birth control, they all kind of work like that. They work sort of keeping the ovaries quiet, which is why they're also protective against ovarian cancer. And they're also good for people who have a lot of ovarian cysts, because it keeps the ovaries from developing those cysts as well. The hormonal birth control that uses progesterone, like the implants or the progestin-only birth control pills, or the progesterone IUDs, those tend to work, and they have a couple different effects. They do work a little bit on the ovaries. They also cause a big clog of mucus on the inside of the cervix, so that sperm can't get through and can't make their way up into the uterus. They also tend to keep the lining of the uterus very, very thin, so that there's no like sort of place for anything to implant.
Great. Yeah, so you talked a little bit about ovarian cancer. So there is a way to kind of reduce your risk of ovarian cancer or uterine cancer by taking hormonal birth control?
That's for sure.
Okay.
Yeah. Yeah.
Okay.
It's a really nice option for people who are in a high risk category for ovarian cancer. It has a very clear benefit. For people in a high risk for breast cancer, there is no clear benefit necessarily. And whether or not there's a risk for people, there's still more research. The jury's sort of still out on that. But it's definitely protective for ovarian cancer.
Mm-hmm.
And the progesterone IUDs are protective for uterine cancer.
Awesome. Cool. So, yeah. So when I'm choosing my birth control method, are there any like health risks that I have to consider, like going into that appointment?
Mm-hmm. Yeah, and usually if you're getting a hormonal method, the person who's prescribing it will make sure that they figure out what other medications you're on to make sure that nothing interacts. They'll ask what medical problems you've had in the past. They'll ask about any history of migraines, especially migraines with an aura, which can put someone in a slightly higher risk category to be on some estrogen methods. They'll ask about breast problems, liver problems, meningioma, which is like a hormonally mediated kind of brain tumor. Very rare, but we always ask. They might ask about if you've had any unusual bleeding or anything else that needs to get checked out before you can go on hormones.
Got it. Sounds good. And I know a lot of my peers have been asking or want to know, will hormonal birth control make me gain weight?
A couple of them might. I'm not going to lie. The method that most commonly causes weight gain is the Depo-Provera injection, which is the every 3 months injection. It is a great birth control. It is incredibly effective. And a lot of people love it, but there is a more likely to be weight gain with that. The average is only about 5 pounds, but that makes a big difference to people. And probably the way that happens is that the hormone that's in it makes you hungrier. So like someone who's already sort of not really quite paying attention to what they're eating, or maybe they don't exercise very much, or maybe they already have sort of a family predisposition to gain more weight, they are at a higher risk to have that weight gain as well.
Got it.
But it doesn't happen to everybody.
Okay, and I'm kind of coming down to the end of the questions, and this one last one. What type of birth control is best?
The best birth control is the one that people want to use.
Awesome.
That person, whatever is best for that person, and that changes throughout your life.
Okay. Okay. Are there any issues with fertility and birth control? Like if I take birth control, am I going to have problems with fertility in the future?
No. No. All the birth control that's commercial, I mean, there are some permanent birth control, like you could have a sterilization procedure. Men or people with a penis or people with a uterus, either one, can get their fallopian tubes. There's different methods of how to do it, but basically a tubal ligation or a vasectomy. Those are incredibly effective, permanent, long-term birth control. But other than that, all the other methods are reversible, and some of them incredibly reversible. Like if you don't take your pill on time on a given day, you might get pregnant. So some of the methods you have to really stay on top of in order for them to work. Some of them not as much, but all of them will not cause a long-term fertility problem.
Along the lines of long-term birth control, so I've seen movies and TV shows where somebody goes and gets a vasectomy and it's reversed. Is that possible with tubal ligation?
It's really hard to do. Most of the time when people have their tubes tubes tied, there's a section of the tube that's removed. And so in order to reconnect them, it's called reanastomosis. It's really hard to do because there usually isn't much left. And then that person has a lot of scar tissue possibly around those tubes, and that can put them at risk for a complicated, like an ectopic pregnancy or a pregnancy that fertilizes in the tube and can't make it down to the uterus. And that's a dangerous, very dangerous situation. So there aren't a lot of people who will do it in the US, though I have had several patients who've had it done in other countries and then come back and been pregnant. And occasionally it works. But it's not very likely. Vasectomy, it's easier to reverse because they leave a little bit more of the tube.
Got it. Okay, that concludes our interview today. I want to thank Sarah so much for being here, for answering all of your questions. And if you have any other questions, please reach out or get in contact with the Let's Talk Sex project on the website, letstalksex.org, or the Instagram, which is Let's Talk Sex Gold Award. Or you can email me at smetcalf@letstalksex.org. And I'll post that on the recording, that's so you can see. Okay, thank you so much, Sarah.